Into my mask these days. This is one that was given to me by Singapore. That's right, National University of Singapore. It's a good mask. It fits me well. It's got a very good metal bridge around the nose, so I get good fixation there. And it's really good across my chin. And I think that it's really important that we wear well-fitting masks. I'm going to talk to you today down a series of themes. I want to talk about COVID epidemiology, and I'm going to try to do a summary of what's happening. I'm going to do a session on hospitals, a few minutes, about 5 minutes on just what's happening in hospitals around the world. I want to talk about national and local action, what we've been working on very much with John and others, and we've been connecting with different countries around Europe. And then I want to talk about individual actions that we've got to do and trying to move away from restrictions onto doing it by choice. And then I do want to spend some time on vaccines, because I seem to spend an awful lot of my time talking about vaccines at the moment, and I want to help with that. So this is a bit of a shift compared with the last one, when we had lots of different people talking about things. This time I want to try to give you my version of what's going on. But this is also the A team who've joined. I'm looking and seeing who's here. What's something out of Star Wars? What have I got that's out of Star Wars? Oh, well. Have I done something strange? All right. Anyway, whatever's going on, I'm seeing some fabulous people joining. It's a strong group. And so I'm really, really keen to show you. Well, is it like something out of Star Wars? Do you know, last night we did a briefing for Kentucky Fried Chicken franchisees across the US. And I once said in one of these briefings, several months ago now, I said, oh, we'll get used to masking and there'll be all sorts of logos on masks. So there were we doing this Kentucky Fried Chicken franchisee briefing. We do all sorts of things in 4SD. And they showed me these masks that have got KFC all over them. And that's what's happening. People are branding masks with all sorts of stuff. It'll get very, very interesting. We'll get all sorts of branding, I'm sure. Kath is nodding her head. I hope it's all polite, Catherine. Anyway, there will be branding on masks. And so I like this one. This is my Darth Vader mask. I was looking at some of the masks that these politicians wear. They're very, very smart masks. They're sort of super hyper grade, $25 ones. Very good, very good. So that's my 5 things that I'm going to cover. But before we start, there is the most important part of the briefing, which is the special moment with our communications chief, who's just been with me all afternoon in a most exciting dialogue that we've just done on food. It is Twee Nguyen. Take it away, Twee.
It's special because it means we get to find out who's joining us. So I'm launching the poll now. Please do share with us where you're joining from. If you're new here, we like to learn which region people at continent people are joining from. Which age range you are, to make sure we're reaching different age groups. And then lastly, to feel the mood of the room, please let us know how you're feeling, and you can answer multiple times for this 3rd question here. I'm going to keep that up and we can come back to the answers later in the session. Thank you very much. And just to shout out to Chris Shipton, who's joining us today, who will be our illustrator. Thank you. Back to you, David.
Thanks. Those of you who've been with us before know that these sessions rarely have a routine. They tend to vary a huge amount. That's deliberate. But at the same time, there are some people who've joined for the first time. And so it's very good to see you here. Today, yes, I do want to do a bit of a run through on some of the issues, but I won't make it last for more than about half the briefing, and then I would like you to talk. There are some special people on here. I want to welcome my eldest son, Tom, who I see is on. It's fabulous that you're here. Thank you, Tom, for joining. I want to welcome John Atkinson from our team, together with my brother William, who's also from our team, and Catherine Deland, who's here, also from the team. So that's great that you're here. Very good. I'd like to just really welcome individuals because we are quite a family and we've worked that out amongst ourselves. So Tracy from Vancouver, Jonathan Fitzsimmons from UK, Terry Jackson, Gawaha Atif from Montreal, I think, Annie Felton from Colchester, Julia Nelke from the northwest, but I'm not quite sure which part, Julia, probably Wirral side. Rebecca Cantor from Santiago, Holly Wheeler from UK, Karen Kaplan from New York, lovely to see you. Sarah Phillips from UK, and very glad that you're with us. Ad Spikers from Netherlands. Ad, your work in helping us get a convener for the Bangladesh Food Systems Dialogues. We've succeeded. We got the convener nominated just yesterday. Thank you, Ad. Henk Bekkerdam, also from Norway, from Netherlands. Foyzier Rashid, who's worked with me before on a number of issues and is here in Geneva. Kerry, thank you for joining. Loy Rago, thank you for being here. Lovely. And Mutefa, I'm pretty certain you're from Habaroni, and it's lovely to see you. Miles Breeden from Nairobi, Joe Nichols from Nairobi, Patrick Wilson, hello. I think Flo's on as well. Florence Lasben, thank you. And then there are people I don't know. Karina, I don't know you so well. Iman Ahmad, lovely to see you. And then Carl Taylor, thank you for being with us. Ruti, thank you for being here. Dila, Caroline, and Louisa, lovely. I mean, why am I picking you out? Hello, Caroline. Why am I picking you out? Because it's really important. We are on these calls as individuals. We are on these calls as part of a group. We are trying through our own networks to help people to get on top of COVID, and there is a long distance still to go, and we must get it right. So let's just start now with my resume. Just to help you to know what I'm using as my sources, I draw a lot on a regular publication called Compass that comes from the International Peace Institute. I draw a lot on the WHO regular press review of what's going on around the world. I'm a subscriber to a really excellent newsletter produced by Dr. Robert Levitt in the US. And I'm also quite a heavy user of the WHO situation reports, which I sometimes show you. I participate in meetings about once a week, mostly now, with WHO technical staff. It's incredibly rich that I'm able to actually be briefed on what's going on. Very, very appreciative of Mike Ryan, the head of emergencies, Maria Van Kokova, who is the chief person in charge of risk management in the WHO team, Oliver Morgan, the epidemiological guru, and various others. Why am I saying this? I want to stress to you that what I offer you here in these twice weekly briefings is as correct as I can get it assessment of what's going on. So let's quickly go into the epidemiology. What I tend to do is to divide the world up into bits and then to base my assessments on that division. The division is pretty much influenced by the way the World Health Organization is divided into 6 regions. World Health Organization Europe runs right through from Ireland to Russia. And it also runs north to south from Finland to Greece, Finland to Turkmenistan. And it is really a very, very large region. And so I use the WHO European region as my main point, and that's why, for example, I pay a lot of attention to what's in the findings from the European Centers for Disease Control in Stockholm. Now, when I'm looking at the Americas, again, I use WHO information, but I tend to divide the Americas into, quite simply, Canada and the US, and then Mexico south. It's obviously quite complicated because you've got North America, Central America, the Isthmus. You've also got the islands, the Caribbean, like Haiti and so on. And then you've got the whole of Latin America. Then I deal with Africa, which is I deal with as a continent. I deal with the Middle East, which is very north of Africa, right through to the Gulf. And then Asia is in two parts, the parts that are around India, and then the part that's further eastwards, China and beyond. So in Europe, over the last 3 weeks, there's a really significant reduction in the incidence rates of COVID. And death rates are starting to drop as well. And I just think it's really important that after me telling you that I was really worried about the Europe figures, I'm now seeing that the curves are peaking and the cases are beginning to come down. They're not coming down as fast as one would like, but they're coming down. And why? One, because people are taking this virus seriously. Not everywhere, but the mask wearing rate is about 65%. And there's physical distancing practiced in most locations. And there's also quite a lot of restrictions on people in Europe at the moment. Large gatherings are prevented. And there's a fair amount of restrictions on what people can do in their homes. Those restrictions are being have been tightened up and are being slightly reduced now because we're getting close to Christmas. But the impact of the restrictions, the impact of all the changes in behavior, particularly over the past 3 weeks, is, as I said, leading to numbers reducing. It's the second time round that we've seen it, and it's actually very, very clear. If you stop everything, then numbers of cases come down. And so the European story is one of fluctuating between lots of movement and restricted movement. And when you restrict movement, your incidence comes down. But we've got lots of examples now from different parts of Europe, which are showing us that communities are able to get on top of this virus through their own action. We discussed last time, John has been doing these studies of different parts of Britain and has shown that where you've got well-organized local action with a short time interval between case detection and testing and isolation and effective isolation, where you can build that into your response, then that keeps the numbers down, but you can still move around. And that's the beginnings of the early signs of European capacity to actually get alongside the 24 countries in the world that are doing well, most of which are in East Asia. But we're beginning to see little islands of competence in other places as well. It's still a long way to go before it's widespread, but you're seeing them come up in bits of Germany, in bits of France, in bits of Scandinavia, in quite a lot in Spain, and quite a lot in parts of Britain. People are getting it together through local organization, local government, and also through this integrated action between religious groups, businesses, local authorities, community organizations, universities, schools, and more. And it's absolutely beautiful to see it happening. Sometimes it's around a school. Sometimes it's around a university. Sometimes it's around really effective local government action. There are certain parts of Britain where local government action is so good. Sometimes it's around a business really stepping up and saying, we're not going to be the place where COVID clusters build up and cause problems. We're going to be good. And we've got some examples of great business. It's so important that I share this with you because it just shows that there are the shoots of the kind of community organization that we all want to see. Am I right, John?
Yes. Do you want me to add something more on that at this point, or are you?
Why not? I can't resist you. You're next to me on my Zoom, so I have to hear your voice.
Okay, so I did a nod, but I could actually say a little thing. One thing I've been doing last week was sort of just ringing around some contacts in England and saying, well, what's happening? Because one of the things that's interesting in all this is the sort of paradox about the way our human systems work. They often work in the opposite way to the way we think they do. So what happens when you start to look across levels and follow somebody through a process rather than just say, well, how does the thing I've designed, whether it's test and trace or hospital admissions or whatever, rather than just look at that and say, how does it work? And what you find is sometimes quite surprising, but sort of obvious. Because what we really want from this is people isolating. We want to break chains of transmission, not just run lots and lots and lots of tests. The tests have to be for a purpose. And what I found when you start digging around are these sorts of paradoxes. The people we most want to contact are the people we get round to contacting last, because they don't come forward, they're harder to find, they maybe don't want to be found, and so they're the people we get to at the very end of our contact tracing processes. And the people who are probably isolating already are the people we get straight away. The other thing is the people that we really want to support are the people who we make it quite hard to support. People who are in work, but bouncing between 2 or 3 jobs, warehousing, taxi driving, care home working, whatever. They don't quite hit that trigger where they get the sort of payments. They're not employed, so they don't get the furlough payments. And so they have to keep on working. And we make it really hard to support them. And if we want people to look after those people, the people who can really do it are our local organisations. So they've got over 100 different pathways in England, and it's the same in Germany, it's the same in France, it's the same in Austria, it's the same in Switzerland, of looking after people with all sorts of different needs. But the more you tell local organisations what you need them to do, the less likely they are actually to do it, because they're so constrained and they start asking. So when we understand how people are actually using the systems we put in place, we can start to change them. And sometimes little differences, like getting to particular groups very, very early, can make profound differences in terms of spread of transmission. So that's what I've been spending my time doing a little bit, David. And if you look at it through that lens of how do people use what we're doing, rather than how well does what we're doing work, sounds almost the same, but it makes a phenomenal difference.
So John, in a way, describes how, because of COVID, it's actually become necessary to reinvent community, to reinvent society. And of course, actually, community and society have always been there. But what he's also saying is the governments and government process is having to learn to connect with society in a way that's meaningful. Am I right, John? It's a learning process underway.
It's exactly that. And when you are in government, it's so easy for people to criticize. But when you are in government, you just try so hard to set things up that work everywhere and try and put in place processes that are fair and even. And what you actually do is create things that are exactly the opposite, because places are different, people are different, needs are different in different places. And the more you try and corral it into one sort of approach, the more people start to fight back and get frustrated. So it really is a very hard thing to learn. But when we put in big national systems to deal with communities, those two things aren't necessarily, the same thing.
Thank you, John. Now we're going to go across the Atlantic. We'll go to North America. We'll go to the US. So over Thanksgiving weekend, I was looking at where is COVID in the US. Now, for many months, I've been saying the countries that do well, the communities that do well, hold the virus back. Look at New Zealand, look at Cambodia, Vietnam, Taiwan. Look at Hong Kong, South Korea. They basically stop the virus from gaining too strong a foothold by to stopping spikes the moment they appear. But if you sort of let go, and if you don't hold that virus back, perhaps because you've just not been sufficiently robust, or you've been half-hearted, or you've said, well, it doesn't really matter, then that virus very quickly spreads and spreads and spreads, and it goes everywhere. In the United States, COVID is in 48 states. In the moment in California, it's causing havoc. It's coming back into New York. Sorry, it's coming back into New York. It's actually in quite a lot of the eastern seaboard. It's in the Midwestern states, the states that are quite rural. It's overloading hospitals. And some of those hospitals are really in big trouble. They have run out of PPE, I'm told. Not all, but some, usually those serving very poor populations. And it's getting worse. Dr. Fauci says that growth is exponential. And most are saying that the current daily death rate of 2,000 is set to increase several fold in the coming 4 to 6 weeks. This is really serious. I don't want to say that it's an impossible situation. And I'm hopeful that the people who are coming in during January will be able to really get ahead of it. But it's going to be a tough struggle for them. Because when you've got a lot of virus in a lot of communities, very high % positivity on testing, lots of people in hospitals, overloaded intensive care units. When you have that situation, which is the US situation, pushing the virus back is not an instant job, especially if it's politically difficult to get stay-at-home orders executed and to actually reduce people contact with each other. I mean, that's just been the situation and continues to be the situation. There's a lot of movement, there's a lot of transmission, and there's a lot of virus all over the US. Canada is less serious, but Canada is not an island. It's kind of very closely connected to the US. And so there are parts of Canada with a lot of virus too. And then Mexico, I should really group that with the US and Canada because yesterday, I think it was, Tedros really was concerned, the WHO head, about the situation in Mexico. It's really very high, the levels of disease and the death rates. I think we just have to recognize these 3 countries, but particularly the US and Mexico, have major COVID challenges. I know some of you are from these countries. I'm not trying to just add to your woes. I just want to stress that we are currently still in the European epicenter, so we know super lot about what it feels like to be in a place where the hospitals are full and where the transmission rate is high and where you really have to be careful. But that's the US, Mexico, and parts of Canada. And it's not too good as you go further south in Latin America, but actually countries have done remarkably well. I mean, Argentina, Chile, Uruguay, they're trying. It's not perfect, and there's a lot of COVID there, but it's not as bad as it is in Mexico and the US. Let's go across to Africa. Generally a pretty comfortable situation right now in much of Africa, but not everywhere. Kenya, still quite bad numbers. Further north, Morocco, not good numbers. And so it's a partial situation, but still we're looking at Senegal and we're looking at other countries in further south in Africa, surprisingly good, all things considered. India, it's had a very tough time, but it's currently not so bad, but Nepal and Bangladesh still struggling. And so, as so is Indonesia and the Philippines. So it's kind of they're not worrying me quite so much, but also not very good. Some war zones have got particular problems. Gaza has got a lot of disease. Syria, Yemen have got a fair amount of disease, and we worry about those war zones. So what I'm trying to tell you is this virus is still all over the world, but it's very different in its patterns. And that's exactly as I would expect, because it's got small outbreaks that start as spikes and develop into surges. And the way in which it evolves depends hugely on the extent to which people are trying to stop it from spreading. But in countries where political leaders have almost deliberately invited their people to move around and mingle and so on, that's where you've got rapid spread. I wanted to go on a little bit more about hospitals. I'm talking a lot to health workers around the world. They are tired out. They're in many cases having to cover because some staff are off work because they've been exposed to COVID. Some staff are off work because they are exhausted. Some staff are off work because they're not feeling mentally well. It's been a really, really, really tough time. Here in this part of Europe, we're told that staff shortages is the main problem of keeping beds open in hospitals. And staff are just feeling that they've been running a constant marathon since April or May this year. I think this is a real problem. I think the exhaustion of health personnel needs to be taken on board. I'm sure you've picked this up. There's also problems with equipment, but that's not so bad. And I would say, lastly, in hospitals, that it's proving very, very difficult to keep open non-COVID services in hospitals all over the world, because the amount of COVID in many hospital settings is just so much that it is leading to shortages of staff in all departments. So the situation for hospitals and the situation for health workers is not getting a huge amount of publicity, but I don't like it. I think, though, there are continuing to be the gradual recognition that it's up to all of us to do what we need to do the right thing by choice and not because we're ordered to do it, to wear our masks, to maintain physical distancing, to practice really good hygiene, to stay isolated when we're sick. I haven't got the numbers. I talk to others and they say the numbers are rising slowly in Europe, even in Canada and parts of the US. That's what's going to carry us through this, is everybody actually doing the individual actions that are so important. I'm talking to more and more people in the advertising sector and businesses more generally, particularly the restaurant business, where we're seeing business leaders wanting to set the example. Yesterday, we talked to the owners of numerous Kentucky Fried Chicken outlets. It's very interesting. They want to do right in their communities. They want their employees not to get sick. They want their customers not to be sick. They want to be contributing to COVID-ready state. And I think that more and more we're going to see businesses just getting the point that unless they do this and unless they get it right, their own markets are going to diminish. So we talked to so many businesses recently, and we're getting that message more and more. Business wants to be on the side of right. Universities want to be on the side of right. Schools want to be on the side of right. Community organizations want to get it right. It's not as though businesses are all the time just screaming and shouting and getting angry. They know that this virus is still moving around. They want to be able to continue their businesses, but in a way that is safe for their employees and for their people. I see this as another example of change. I'm seeing this change happen pretty fast. One of the reasons people say why there's change is because of all this talk about vaccines. We've got the Pfizer with BioNTech super cold vaccine that's got the 94.5% efficacy and that seems to be safe. It's going to go for all the regulators in the US and in the UK. Anytime now, it's probably going to the regulators in the UK. quicker than it goes to regulators in the US. Most people reckon it's going to get an emergency use authorization, both sides of the Atlantic. It's expensive. It's awfully difficult to look after because it has to be kept so cold. But it seems, at least for some, it's going to become available. Not huge amounts, I want to tell you. The amounts available in the UK are going to be small, in just a few millions of doses. Count them on the fingers of one hand. Amounts available in the US are not huge. So it'll be bits of vaccine coming out early from Pfizer and BioNTech. And then there's the other one, Moderna. Doesn't need to be kept so cold, just as efficient. US has bought more of the Moderna vaccine, though other countries are coming in and buying it. And so these two vaccines, both experimental, both RNA vaccines, are likely to be licensed in some European countries and in the US within coming weeks, and administration is likely to start. Now, they will go to people at highest risk of sickness and death. They will go to old people. They will go to people in residential care. They will go to people with diabetes and with hypertension. They will not go to the whole population, not at the beginning. Over time, they will go more widely. But I think these vaccines will be used to try to cut the death rate. And I think they will be treated as another arm in the response strategy, but it will still be necessary, particularly in the early months of vaccine rollout, with these two vaccines, to continue with the physical distancing, masking, hygiene, self-isolation when sick. So you basically add the vaccine as another intervention. I want to stress to you that there seems to be another good vaccine coming along. This is developed by Pfizer and AstraZeneca. And the vaccine looks pretty good, but there was a little bit of a slip up in the in between different arms of the phase 3 trials. And I think that it may well be necessary for there to be further trials before this vaccine can be made widely available. This is a pity, because it's a lot less expensive than the mRNA vaccines. And that means that it can be more widely administered. It also doesn't need to be kept so cold. But there is work to be done to try to overcome the fact that there seems to have been, and it really does look like a dose error on the vaccine. So this needs to be looked at, but I'm truly hopeful that the Oxford University AstraZeneca vaccine will become available soon. There's also a Russian vaccine, but I don't know the full details, and I've not seen the results with that. So just to keep straying to you, vaccines are not going to solve everything, but they will be added in as an extra layer. And what we're all going to have to do, and it's super hard work, is we're going to have to continue to advocate for the universal precautions that I talked about at the beginning. So that's my summary briefing, that epidemiology, bit on hospitals, the importance of good local action, the absolute need for us all to do what we can to implement non-pharmaceutical interventions, and some positive progress on the vaccines, but it's not enough to change everything. People said to me, how long before the vaccines really do clip in? Well, I've said it's a global thing. And that's why I'm such a keen supporter of COVAX, which has had 5 billion financial input as a scheme for enabling all countries to be able to access vaccine. It needs at least another 5 billion. And there needs to be a lot of political action to make sure that, given the scarce supplies of vaccine available so far, that more and more of the doses can get to poor countries, developing countries. But it will be a bit of delay, and we're going to have to advocate like anything to get vaccine equity. and not have it all captured by rich countries. And that's going to be, I believe, quite a big issue, going to cause quite a lot of anger in the coming weeks and months. And an awful lot depends on member states supporting this COVAX initiative that leads to more equitable access with cash. And will they? I'm not sure. So I have to keep pushing. And all of us need to keep pushing. So those are my main points. And though there are quite a lot of questions coming in, I will go through them one by one and invite people to speak. Terry Jackson asks if I also use Johns Hopkins data. Yes, I use the Tulane Medical School daily reports. I forgot about that. And they always have the Johns Hopkins tracker on them. Johns Hopkins data and the WHO data, as far as I can tell, are pretty similar. They're not identical, but if I look at the overall epidemic curves and the information about individual countries, they are remarkably similar. So Annie Feltham says, fine, David, you talked a lot about the clinical aspects of this pandemic, but what are its impacts all over the world? They tell me that the economic impact of the COVID pandemic is really going to hit in 2022. That's when the real hard part is going to come. The contraction in economic activity will really build up because we're going to have continued limitations on movement from time to time and anxieties and so on through most of 2021 until vaccine use is more widespread. And the big impact is really going to be felt when young men and women are leaving school and are looking for work and they're not going to be able to get it and they're going to get poor. And so it's basically from about the end of next year through into 2022, we're going to see really serious economic consequences. And they're going to be to do with rising unemployment and increasing poverty. And it'll be poverty, it's income poverty, it'll be food poverty, and also there will be real challenges of ensuring that poor people can realize their human rights. It's not a good sign, and it's going to require really imaginative governance. And we're not just talking here about Europe and the US, we're talking about most nations, and the developing nations are not protected from the economic impact because they're super affected by what's happening in the northern countries. And it will play out in all sorts of things like malnutrition, like unemployment, and like lack of access to essential services, difficulty of countries to provide social protection, and so on. So Rebecca Cantor says, Chile is on a 5-step plan. Numbers have not gone back up too much after 5 months of lockdown ended. There's still some restrictions. I mean, that's the reality. A lot of countries are maintaining restrictions to keep their numbers down. They want to do everything possible not to get them back up. It's very brave politics because, of course, if you can keep your numbers down, then it's really much better for society. And if you can get enough political support to keep your numbers down, that's great. It's in Europe, most governments feel that they haven't got the political support to continue acting to keep numbers down. So they start loosening restrictions and encouraging movement when their case numbers are still quite high. And that just gives you more surges. So it's really, really difficult in Europe. Gawaha Atif wonders if Canadians on the call have examples of integrated community work. I know that in Egypt, it isn't necessarily increasing due to COVID, but there is a tradition of community and family support in a crisis. My colleague Maha Rabat, one of my fellow envoys for WHO, is telling me that the community support structures in the Middle East have really increased and are working extraordinarily well in her judgment. Let's see, it's often very difficult to be sure. I think in Canada, I don't have really a very broad selection of people advising me, but I think there are many, many examples of groups coming together in Canada, holding things together. Joe Nichols says that the surprisingly good elements of what's being reported in Africa are still worrying, because it could mean we don't fully understand what's going on. I totally agree with you, Joe. You know, will there be surges coming up in Africa? I mean, we're seeing them a bit in Kenya at the moment, but will big surges come up like's happened in Europe? I don't know. There's so many things we don't fully understand about this virus. Caroline Smith DeWaal says, any advice for managing COVID-19 in informal markets that are so essential to providing foods and livelihoods in low-income consumers? Caroline, are you on? Are you on? Can you unmute? Be quite good to hear from you. What are the particular situations you're thinking about? There you are, Caroline. I can see you. Nice to see you again.
Nice to see you. I'm with Gain, and we're working with informal markets on a project looking at COVID impacts. But I've been asked to help give some advice, and anything you have would be welcome.
Well, it's been really tricky. For example, in the Indian subcontinent, as you know, there was a major spreader event out of the markets, the fresh food markets in Chennai. And the reason why the market was open in Chennai was that this was vital to the economic well-being of poorer people. But unfortunately, the particular features of the market with people very, very close together, not really much physical distancing, people not wanting to wear masks. And it was a very serious spreader event. And the market is just really unfortunate because people go all over the place out of the market. So they take the virus everywhere. Then we had a situation in China, in Beijing, a market which became a major center for spread of virus. And there, it was not actually contamination through droplets. It was looked like it was a surface-borne spread. I think markets are very serious, like church services, like some events in churches where you've got people coming together and then dispersing. They are just not easy, and to introduce physical distancing in markets can be quite tough. So I don't have simple solutions, but Henk Bekkerdam, do you know much about how to get markets safe? Did you work on that when you were in India, Henk?
Thank you, David. I think that's a very difficult issue, and it's the part where, indeed, like you said, people are coming together and then spread again. I think that's the part where it is very difficult. And I don't think, like what you were mentioning tonight, that was a major event. That was in the early part where it showed very clearly while the food was needed, it became also a major spreader. Yeah. And then I think that's the same thing, if I'm talking briefly about India, but perhaps the other people who are now more familiar with India, lots of happening after a half a year, is of course the other challenge what we had is the social distancing in the slums. And that is a major challenge. And I think these are issues where it was very difficult to put it right, and that means major events where at a certain moment you should be ready and willing to move people temporarily out and provide support, because some of those issues in the developing countries where you need, the government needs to come in and provide the right support. But David, just one or two things which I would like to mention as well, and some of the things you know already from what I've been saying before is the public health part. But also something else, David. I think in the Netherlands, I'm now trying to start a discussion that we should now start thinking or reviewing from what needs to be in place in 2022. And then at this very moment, already start thinking about how we need to start investing at this very moment towards it. What I can see governments, what they do now, they do all kinds of things. But are they already start building up a public system, what they need to have in place? And I think we need now to see this, you know, the slogan, this is a major challenge, but it's also an opportunity to start strengthening the public health and start thinking what is needed in the future.
So, Henk, has hit the nail on the head. We're not going to be able to deal with this particular virus or with others unless we have much better quality public health. And right now, it's a bit of a scary time because there are at least 2 other viruses that seem to be spillover viruses. 2 influenza viruses are knocking about. H5N1 is still causing trouble. That's a bird flu virus, and 1 other flu virus. I've forgotten its number. So I think you're absolutely right. We must not spare any effort to keep stressing the need to invest in public health. Thank you. Thank you very much indeed. I want to have a little spell now on vaccines. And by the way, if anybody wants to come in and make a remark and you suddenly feel you have to speak, just start waving your arm around. I've got peripheral vision. I can see if you're doing so, even though I'm trying to look in the camera. So Karen Kaplan. Karen, where are you? Are you on? Can you light up? There you go, Karen. If you want to talk, just unmute. Otherwise, I'll say what you wrote in the chat.
Oh, which comment? About the UK or about the inequities in America?
Yeah.
I guess that's the one I should probably comment on. Currently, I'm still a major gifts fundraiser in kind of the media as well as healthcare, but it was really disturbing over the past week and a half over the holidays to hear from a lot of my current and former major donors that I've worked with, who actually were quite happy to share, not embarrassed at all, that they've actually contacted a lot of their local hospitals where they either sit on the board or they've made major gifts. And they're being assured that they're going to be at the front of the line when the vaccines are ready. And if I hadn't heard it from just people in Florida or in and around Hopkins or places here in New York, but I also heard it from friends on the West Coast. Major institutions, as well as a lot of local community hospitals, they're afraid of losing their donors.
Yeah.
Everybody's afraid of losing their donors now, as money is tight, as you said. So I thought I would share it. I'm not giving away anybody's names or whatever, but I didn't realize that would be such a race, and that they would actually use their position as major donors. Inequities exist every minute of every day here in America, not just in healthcare. And it's been shown to the world exactly what COVID has brought us to our knees, and it has. But I thought I would let you know.
Thank you. COVID is revealing so much that we don't really like about how we live. So many ways, isn't it? Gosh.
Yes. But we can do something about it.
Of course.
Yes, I do believe that.
No, but that's why many of the people who are on this call are the leaders of the future. Many of the people who are on this call are ready to act for equity, and are doing so in their different ways. But it's not just us. There are, I'm sure, tens of thousands of groups like ours who are working for equity and who've suddenly been stimulated by COVID to act and to realize that it's only through acting together that we get the results. We can't do it on our own. So we form different networks, and these networks make change. My guru on network development is John. John works closely with Holly, who's also on here. Holly and John work with countless people working in health management right throughout the UK and beyond. And then through them, we get connected to so many people. But that's the case. Any one of us has loads of networks with which we're all connected. And it's through sharing the word and trying to help others to understand what's going on that we become part of a force for change. In part, we're trying to stop things going backwards, but in different ways, we're also helping things to move forward. And we're connected with many brave people who are often on the front line. People like myself are a bit behind the scenes, but striving for a better world. So thank you.
Yeah, I use the expression build forward better instead of build back better.
Oh, hooray, hooray, hooray. God, I'm so fed up with build back better. I keep saying to people, stop it.
Yeah, I don't want to go backwards. Backwards didn't work for most of the planet. So why are we talking about back? I don't get it. I started using it a few weeks ago during the Paris Peace Forum. Anyway, I'll stop talking.
No, I think it's lovely. Thank you for saying that. Rebecca agrees. Many of us agree.
Oh,
Build
good. Yeah.
forward better.
Okay. Build forward.
Sometimes I say leap forward better, because a lot of what we need to do involves more than just the mechanical activity of building walls or whatever. We actually have to have the energy and the audacity to link arms and actually jump forward better. We've got such huge challenges to deal with. You know, a lot of my time now spent on climate change, and we have to get ready. Isn't that right, John? John and me keep talking about how we've got to leap, leap, leap. And because you can't catch up with exponentials just by going linear. So thank you very much indeed. There are a few questions here, which are tough ones. Thank you everybody for coming in on the chat. Karen, you nailed it. It's beautiful. There are people, Gawaha, Yosef and Joe, who've obviously been talking about these experimental mRNA vaccines. There are questions being asked. And are you surprised? I'm not surprised. There's anxiety about the speed with which the emergency use authorizations are being given, about anxiety that there just might, nagging doubt, might be some still yet undiscovered side effects, because we know that you really work out what's going on with vaccines through the post-administration surveillance, because you have to survey people for 2 years at least to see what's going on. These things don't always show up immediately. So yes, of course there's going to be people anxious. A lot of people will be anxious, especially given that there is the vaccine hesitancy around. They're going to say, look, this is an experimental protocol. It's an antibody against RNA. It's not an antibody against viral capsid protein or something like that. It's actually against the ribonucleic acid. And they're going to be worried. And so Gawaha says, what are the risks? And I have to tell you, Gawaha, I don't know. But I am thinking super hard about it. It's experimental biology. So I'm not going to sit in front of you and say, this is as safe as a conventional vaccine, because I don't know, I can't tell you. Cash, no? You wrote me a brief on it, yeah? No data yet, you see, no data yet. Yeah, they've been studied in animals, they've been studied in some human volunteers. But I was talking to colleagues and they said, look, remember, COVID makes you sick. One, by attacking cells in your body, epithelial cells, endothelial cells, and damaging them. Two, because the body reacts to the damage caused by this virus with a really big whoosh cytokine storm, an immune reaction. And we know from other diseases that the immune response is actually part of the problem. We have here, I can't see where she is, Fawzia. She used to work on tuberculosis a lot. We have people who've done a lot of work on the diseases which are actually manifest because of the body's immune response, of which TB, tuberculosis, is a great example. And so, you know, we will be asking questions and continuing to be a bit unsure. So, and that is a reasonable worry. We should not critique anyone who says, these vaccines are bound to be safe, because they are experimental. I think you're right, go ahead to raise it. Yusuf, I think you're right to say this needs special scrutiny because it's a new technology. Yes. And Joe, yes, of course, there's a lot of questions about mRNA. And actually, the whole infodemic has really been buzzing. Joe, tell me what you've read, because you watch these things very carefully. And then I'll come to Yusuf. Joe, please. Have I lost you, Joe? There you are.
It's just been more related to a lot of people asking questions about whether RNA vaccines can make permanent changes and whether we understand the implications of those permanent changes, but also using it to link to the sort of people who would be very anti-vaccination in the first place, and therefore to perhaps kind of accelerate resistance to vaccinations.
Yeah. I mean, I think that's really important, Joe. You know, we've seen how anxiety about one vaccine leads to people saying, I don't want any vaccine. And that is a problem. This is a live and difficult issue, this anti-vax stuff. And I think, you know, when I read people making these statements about, you know, we're going to rush to administer vaccine in the USA next week or the week after, I think, hang on, you know, yes, it's urgent, but if you go too fast and if you appear to be too gung-ho, you're going to really frustrate an awful lot of people. So Yusuf, where are you? You've been writing about this. I'm just looking for you on my screen. I can't find you. Yusuf, are you there?
I'm
Yusuf?
here. I'm here,
Yeah.
David.
Lovely to hear you on this. And then
Yeah.
a few others as well.
I just want to say briefly that in addition to a healthy skepticism about the rushing through of these vaccines, I mean, I want the vaccine just as much as anyone else.
Yeah.
But I think that there's a certain kind of ecstatic euphoria around the emergence of these, around the public relations about these vaccines. And I think it's creating false expectations that need to be downplayed. And I think more than anything, I think it's concealing something very important that we really need to talk about. And that is, there's a lot of meaning to this pandemic. And we've touched on it. There's a lot of socioeconomic meaning to this. It's really highlighted and exacerbated all sorts of inequities, privilege, insufficiencies. And there's a lot of ecological, environmental meaning to this pandemic, both as a cause and an effect. And we're not dealing with that. I mean, I don't mean this group. I mean, people around the world. We've had this opportunity to really kind of rethink the future. And I think that it's really, really important, both with respect to the pandemic and the future, to understand the meaning of this pandemic. So that's basically what I wanted to say. And this euphoria about the vaccines is concealing. Everyone is interested in going back better instead of forward better. And that's my concern.
Yusuf always does this. He says the really tough stuff. I'd love to just for a few seconds invite others to just help us finish by focusing on this meaning thing. There is meaning. We need to focus on it. Sarah Phillips, do you want to say anything about that? And then after Sarah, I go to Ad Spikers.
Sorry, I'm not really sure about that. I was actually asking the question about the vaccines, technical stuff before, so I'm not on it. Sorry.
Okay, it's all right. Well, don't worry. That was deliberate. And I'll come back to you on that one. Ad Spikers, do you think there's a lot of meaning to this?
I agree with the previous speaker, the gentleman who put us a bit on the spot on the economic impact of the whole story, David. You built that momentum. I have seen you in the media and you have put up enormous reputation. And I think I speak on behalf of many of us in the UN. I'm retired from the UN and not as you, still in the mainstream. That is extremely important thing you are doing by the COVID-19 and the whole story and the run up to the food summit. We know from the figures and from the impressions we have in general that African countries, Asian countries who are poor are suffering even more. And I really want to encourage this discussion also. And I sent you over the weekend a proposal because you put with John a good piece in the Guardian. You spoke with CNN, BBC. I think that kind of information is extremely important, and it can be channeled to your office. I'm also volunteering to see if we can do something on the food insecurity. David, don't forget that the remittances of millions of people who have no job now, I cannot send money back to their homes, is extremely important also. We should not forget this.
Okay, absolutely not forgotten. And thank you. And I promise I will read it. And let me just go to Sarah Phillips. So I'm really sorry, Sarah. It was a bit of a wrong thing to do. I don't know whether or not there is particular problems with making up COVID vaccines, but this is where you have expertise. So tell me whether you think there's a problem here that we need to really take on board. And this is the reconstitution of COVID vaccines from freeze-dried or whatever state they're in. Sarah, tell me.
I had a request in urgently for making up reconstituting bottles, which we do in IV drug administration, but it's not a massive need normally. Actually, there are a few elements to it that if we get it wrong, then it's quite easy to get it wrong, just a little bit wrong everywhere. So it kind of made me think, oh, and I was quite surprised that we needed a mass amount of training for this almost simple but important element. Then I thought, well, what do we really need? Will there be this A, B, C over the course of the year? Because if we access thousands of staff quickly to show them something, then we want to get all of that in really while we've got access to them, because their time is so precious.
Yeah.
Does
Thank
that
you.
make sense?
I will make it my job to try to find more out about this. Okay. Thank you very much indeed, Sarah.
Thank you.
Holly, thank you for joining. Holly Wheeler. If you want to say anything before we close, it'd be very nice. And then Julia Nelke, and then we'll stop. Holly.
Thanks, David. I was rapidly typing, trying to type quickly. There was a couple of things that I wanted to link together, which is when Joseph talks about the fact that there's a depth of meaning in this, in terms of that it's surfacing all these different things that are showing up. I think it's deeply connected to what Henk was saying earlier about the opportunity that this presents. And for me, the kind of role or responsibility that I think a lot of us have here is about making sense of that meaning and putting it into context that people understand, and allowing them to try and find actions that become meaningful to them. Because if we want to change any of this, I think it has to be that people choose to do those things and they need to make sense of it for themselves. So that feels really important, and a link between two bits of the conversation that feels really relevant to me. So
Thank you very much indeed, Holly. Just say hello to Dr. Claire Rayner. I just saw you light up just for a second. Nice to see you again. Julia Nelke, from your perspective, what about this issue of finding meaning in what's going on and not losing that? Does that resonate with you, or did it seem something that was not in your consciousness?
I thought the idea of the community organisation, community networks is really important. I was thinking about in Liverpool where it seems like where the uptake's been low has been where there's been less community networks, and where they've done local campaigning and supporting people, the uptake's been high. So I just think that that's the bit that kind of struck me. And
can I just tell you that really, really, really helpful. What I think I'll do, Julia, is that the next briefing we have, we'll try to look at the mass testing idea that's starting to emerge in different places that's been particularly important in Liverpool. Would that be something that you would be, I mean, you may not, I'm not asking you to promise to join the next one, but do you think that issue of the mass testing strategy that's being adopted in some countries and communities is worth looking at?
I think it's worth looking at, yeah, really important. I don't know that I know much about it. I mean, I can try and see if one of the GPs from Liverpool could join.
Brilliant.
Yeah.
I'd like us to try to do that. Thank you very much indeed. That's like everybody, super greetings to you all. Thank you so much. There's 80 things in the chat. It must be almost a world record. Twee, please, tell us a little bit about who we are and a bit about our mood as well. Thank you.
Alrighty, who have we got here today? Most people from Europe, and good to see 8 actually from North America and 4 from Latin America. So welcome to people from that region as well, which is a bit more than usual. Age range, good spread across. 3 under 30. I see Zara there, and I wonder who the other 2 are.
One of them, yeah.
One is you.
No, I joke, fooling around.
Then good to see the overwhelming majority feeling positive, a few sort of average emotions. And then on that note, I think we, just to let you know, we'll be finishing, I think our last briefing will be on the 18th of December. I will launch another survey to hear what your thoughts about it, including comments about the poll. And I'll be asking for your support on what you'd like in that survey in our LinkedIn community chat. So watch out for that there.
Thank you. Very important. that we have it. Ad Spike has pointed out that we're very busy on food at the moment, and particularly on the relationships between food and COVID. I want you all to know that because that's preoccupying us. We're also just starting some work on health in the climate crisis, and we've just released a report on actions that every health professional can do, either themselves or working through others, to impact on climate issues. Could we go to Chris Shipton, please? Our total hero, Chris, amazing illustrator. Thank you for joining us, despite the fact you're in hot demand. Let's see your screen, Chris.
I've had some horrible technical troubles, and this is my backup iPad, and then my Apple Pencil ran out of batteries. So it's scribbly and not finished, but...
It even happens to you, Chris. I thought that these sorts of things never happen to you. Like pen.
I'll try to avoid it, but I think I've got the gist of it anyway.
Thank you very much indeed. And we love your stuff, so we are honoured. Even if we've only got 3/4 of one of your picks, it's lovely. Thank you very much indeed from all of us. I hate ending these things, but all good things do have to come to an end. I think that's a truth. And so it is time for me to say goodbye on behalf of all of us. Just tell you, we are, so that you know, Twee, who is our comms person, Catherine, who is our health advisor. Catherine, are you alive? I can't see. Yeah, there you are. Yeah. Great. Good. And who should be on as well. And then I think I saw my brother on. Tom is on. And then I also see my grandson, Isaac, with his mum, Polly. And you can see Isaac moving around. Zoom user. Hello. Hi. Good. Special shout out to Marianne Hazelgrave. Marianne got, she's managed to get the Commonwealth Medical Association speaking slot at the forthcoming summit on COVID that the UN is organised. Marianne, isn't it brilliant? I hope you're pleased.
It's done. 13 takes, I think, but it's done and it's ready to send off.
So that
14 takes.
It's done. 13.
It's done. 14. We tried 14 times before we decided it was okay.
Oh wow!
But it's being put together, and it's gone to South Africa to be fixed, to put the sound into the video, and it'll go to them tomorrow probably.
Very good.
I only heard about it at 5 o'clock this morning.
That's pretty heroic stuff.
But it's we've said the right things and brought, as you know, thank you for your help, and we did make sure we mention communities.
Yeah, absolutely. Wonderful stuff. So on behalf of John's there, thank you, John, all the time for your amazing support, despite things being up and down. And Polly, special, lovely to see you. I am lucky that my gorgeous daughter is able to join. And my son, though he is, he's not switched on. That there, everybody, is Otto, who's fast asleep. Very beautiful breastfed boy. And his brother, Isaac, is the one who is very interested in fire engines and such things.
Are you going to say hi? Hi. You've got to look at the camera, not there.
Oh, well, he's not yet. There he is. Yeah. Isaac.
Say bye-bye. Bye-bye.
Bye-bye. See you again soon. Friday together if you